Dr. Diane Cridennda, practicing traditional Chinese medicine at East Winds Acupuncture in Colorado. And with me here today, I have Dr. Paul Magarelli, who is my husband. I think most of you know that. Research led to romance. So here we are in our African living room. So I'm going to turn the table here a little bit, and I'm going to ask Dr. Mag.
She doesn't call me that at home.
Questions just kind of about what's it like to be an RE working with an acupuncturist. So, Dr. Mag, I know that a lot of my colleagues find it very difficult to connect with reproductive endocrinologists because they feel it's not scientific.
Mm-hmm.
So, what would you say to that?
I think science is in everything we do. There's a science of baking, there's a science of gardening, there's a science of carpentry, there's sciences in everything, and science is just observations that are quantified and repeatable. That's what the scientific method is. Make observations, ask questions, and if the results are repeatable, then you may be stumbling upon a hypothesis that makes sense, and then you may actually come up with a law of nature, like gravity, or of light. There are various laws associated with that. So I think in dealing with reproductive endocrinologists, we're sort of the eggheads of medicine. We pride ourselves in creating a field of creating life. If you think about it, we only started in the 1980s as a specialty. So those who were drawn to it were very scientific oriented, entrepreneurial, as well as, we have to do a thesis, we have to do specific research that's published to even get certified in our field. That's not true of, I don't know if that's true of any other field of medicine where you actually have to publish and come up with a hypothesis. So they're a little bit nerdy.
Yeah.
Yeah, so I think they're skeptical.
Sure.
And unfortunately, because they're an exclusive club, or had been, they little bit, self-centered, narcissistic about they know everything.
Right.
And it's not, it's the way, don't laugh.
I wasn't going to say anything. I'm sorry.
That's all right. So I think the acupuncturist who presents themselves in a less than rigorous fashion, maybe with, and I'm being typecast here, in Birkenstocks and flowing and smelling of moxa and hair braids, right? They may be seen as less than a rigorous, scientific, or medically oriented person.
Sure. So IVF and fertility is very scientific. It's very scientific. And if I remember right, when Louise Brown was born, I don't remember how many cycles they actually did.
200.
200 cycles.
To get one pregnancy.
Right.
And that's a 0.05% pregnancy rate.
Oh, God. And then I remember they said they had to actually go through the abdomen.
0.5, not 0.05.
Okay.
Yeah, sorry.
They had to go through the abdomen to get the eggs.
Yes.
Right.
Yes.
So
well, actually, in that case, if I remember, they washed the uterus to collect the egg as she ovulated it, then fertilized it, and then put it back.
Okay.
That's how they they originally did it in the first case.
Right.
Yeah.
So basically, I think what's happened is, the science has just grown in terms of the technicalities and the medications and those kinds of things. So,
Sure.
So it's highly scientific.
Yes.
And
Yes.
there's no gray areas, right?
Well, we have a double-edged sword. In working with humans, in human reproduction, there's a lot of social, political, religious, governmental, there's a lot of fear or potential harm that is envisioned this could happen if you start playing God. And in any way, if there's any area of medicine where people feel they're playing God, it's in the creation of life.
Sure.
I mean, some people say you're playing God if you save someone's life from dying by putting in a stent.
Right.
But if you think about it, creating life from nothing, or from parts,
right.
So that enhanced scrutiny, I think I don't think originally acupuncturists understood the risks that we have
Right.
in dealing with any changes that we add to the fertility soup.
Right.
We could be responsible for the kids' education, or actually for the rest of their lives financially, and it could destroy a practice, it could close a practice. There were so many eyes.
It's rigorous.
It's very rigorous,
Yeah.
but there's also a lot of scrutiny.
Okay, sure.
And it's appropriate. I mean, messing around with human reproduction has got to be kind of scary if you're not working in it.
Right.
You think that, like, everyone still thinks that we do it in test tubes. We never did it in test tubes, but they call it test tube babies. We never did it in test tubes.
Right.
And you know, and they have this eugenics, like, we're going to create, oh, I want my baby to be blind, or I want my baby to play the violin. They still actually have somewhat of a thought that that's something we do, and it isn't. So when you or anyone approaches us, there's a whole shoulders of responsibility, medical, legal, social, religious, that we carry with us. It's a very unique field.
Yeah, so I was just thinking about like Tesla and
Edison.
You know, it would have been like that because everything had to be just so. They had to document everything. It was scientific. This was like a whole new thing.
Never been done
And so
before.
it had to be proven on paper and physically.
And what's the first fear? That they were going to kill everybody.
Yes, that they were going to fry everybody.
Right. So, yeah.
So what's interesting is in Chinese medicine, you know, our professors would say, we'd say, well, is there any research done on that? And they used to say to us, well, patient comes with back pain, you put needles in, pain goes away. What do you need? Research? Right?
So your Chinese guys were Jewish.
No, but that's what I mean is like when and more and more it is becoming scientific because they're proving now that the acupuncture points are near nerve bundles, and that sends a message through the nerve bundle up the spine to the brain to make those changes. So it's biologic.
It has to be.
It has to be biologic.
Yes, it has to be.
And it does affect hormones, parasympathetic and sympathetic, and that's why when you do a treatment like for pain, patient comes in with pain, you put needles in, it goes away. Doesn't mean it's going to stay because we have to keep reminding the body to break that synapse that's stuck.
And I think where you were going with that question about Louise Brown was the other concern, unfortunately, in America is that IVF is a highly unfortunate competitive field of medicine because of legislation, not because of the individuals. I think it was either a congressman felt he was manipulated by a fertility center, so the Wyden Amendment made us report every result. That's like asking your primary care, well, how many cases of the common cold have you cured and what's your rate? Or how many times did you have to give antibiotics to fix that person's infection? Or nobody does that. Now in certain fields like cancer therapies, heart transplants, of course they have that data, but in our field, we were immediately put onto a crazy defensive offensive because all of a sudden, essentially our underwear was shown, meaning these are our pregnancy rates, these are our miscarriage rates, these are how many babies born. And even though there was a banner which said you cannot compare clinics, everybody compared. Even to this day, there are special websites that take this data that you can't compare and they compare. Sure. And then everyone will, on their website, will say, I'm number one, I'm number one. We have so many number ones, there's no number twos in our field because everybody's marketing. That crippled collaboration, cooperation, knowledge acquisition, shared research, shared outcomes. That slowed our medicine down. Not too much because we're very aggressive and rigorous entrepreneurs, but that disallowed the normal collegiality. So you're coming in now and you want to help me, right? And you have your Chinese guy saying, oh, you put needle in, you get better. And that's what you have, and you approach a guy who's trained at UCLA, trained at Duke, you know, everything is rigorous, board certified, you know, PhD, and he looks at you and goes, what? You know, no way am I going to put my patients and really my practice at risk. And so it's reasonable from that sense, and that's why when I first met you, mine was unless they pay you in chickens, don't, you're not going to see my patients. And the only patients I would send to you were patients who had no chance for me.
Right.
That I failed and failed and failed. I said,
used
okay.
all your tools.
I used all my tools, and I said, okay, here you
You
go.
had read enough to
Yes,
know that it couldn't hurt.
Right. Well, I had offered you the challenge.
Yeah.
Show me the data, not thinking you would do it.
Yeah.
And what you did was you kept showing me the data, showing me the
Yeah.
paper, and this in turn sort of expanded my comfort zone that I'm not going to do harm, piqued my curiosity. I'm very curious about things. I like asking questions, and I think REs are always, reproductive endocrinologists like to ask questions. So we're curious, and if there was a chance that I'd be better than my neighbor or my competitor by doing this, that's icing on the cake.
So we've had experiences where I have gotten your patients, your difficult patients, pregnant just with Chinese medicine
I know.
and herbs. So don't you feel competitive with me? Like, oh my God, I missed out on that IVF cycle because she got her pregnant, or
I don't.
No.
I don't think that was ever a thought. It was a fascination.
yeah,
Now, I'm not saying that if we weren't a couple and that kind of thing, that may have changed, but it's been a fascination. Actually, what's driven me to teach at Yosan University, teach the 5 branches, to be an advisor to the American Board of Oriental Reproductive Medicine is I think there's I'm not going to use the term, there's magic, but there's scientific facts that are in the body of traditional Chinese medicine that can be ferreted out in a Western fashion and explained in such a way to use Western medical terminology that, for example, this whole idea of utilizing traditional Chinese medicine with growth hormones on poor responders, and our data shows that you have additional eggs, additional blastocysts, and the more eggs, more embryos, more chance of success. So, and we do it vigorously. I mean, rigorously, we do that. So, and I think others have too. It is not that important to others, though.
right.
To the reproductive medicine community, they have so many things on their plate. It takes specialized people like you and myself and others around the world, a handful, that continue asking those questions. And I think there's more to learn. So no, I'm always fascinated that because it biologically doesn't make sense that it should work, but it's like the acupuncturist said, your doctor, you put in needle, pain goes away.
Right.
You don't have to explain it.
So I always say there's science and then there's nature.
Right. And
you guys are the science and we're the nature. If you correct nature,
science is better.
Right.
And then if you have a scientific tool to understand nature, you can enhance nature.
Right. Cool.
Very nice. Thank you.
Yeah,
Thanks
you.
for having me.
You're welcome.
So why don't you sign off, or I will.
Okay, go ahead, sign off.
So we're going to sign off. This is, I think, our 4th in a series. Diane was taking lead this time, and if you have questions that you'd like Diane to ask me, please make them as challenging as you can. Our goal is maybe just something for you to do during this pause in pregnancy. As we've said many times, our goal is reproductive integrative medicine. So we want to talk about things and cross-pollinate with each other and ideas. And right now we're kind of doing a lot of review with you of our history of 20 years of working in this field. But actually what I'm hoping is you challenge us, with your questions, and send your questions to either Dr. Diane at info@eastwindsacupuncture.com or Dr. Mag at info@magarellifertility.com. Go to our websites. We each have information. We have all of our studies on Diane's website. And of course, our studies are littered throughout the internet.
If you just type our names in, it'll come up quick.
Especially if you join them together. Well, anyway, thank you for spending some time with us. We hope you found it worthwhile. Thank you.